Hello there, friends. Rochelle, Insurance Girl, here today for a very special episode of Just for the Health of It. I am so excited to bring you this amazing guest. As you guys know, this show is all about taking control of our health and our healthcare spending dollars, making sure we're spending those wisely. And we all want to know what else is out there for us. We all want to know about the other options in medicine. It's not all about Eastern or traditional medicine. And that is where my most amazing guest comes in today, Dr. Marcie Falco Salazar, acupuncture physician. Thank you for being here today.
Thanks for having me.
Oh, I'm so excited to have you here today. We've got so much to talk about, and you bring so much value whenever you come and are able to share and educate us. So I am thrilled to hear more about this. So let's jump right in. So tell me a little bit about your practice. I understand you've been in practice for 22 years.
Mm-hmm.
My goodness.
Been in 22 years, various locations, and settled in Safety Harbor for the past about 6 years or so.
Nice.
Love it there. Love it there.
You know, you run your practice differently than some other physicians, and I know that your background as a teacher probably has something to do with that. Can you tell us just a little bit about that journey, that transition from teacher to Eastern medicine?
Sure. Well, I taught for about 12 years or so, and I was raising 2 children at the time, and was always interested in natural medicine. I did a lot of reading, a lot of searching, and have been a lifelong learner. I actually thought that I was going to go back to medical school after teaching for about 12 years and wanted to practice natural medicine along with, that in that realm.
Oh.
And a friend of mine, my best friend here, had said to me, I know that you've gone back to school. I started taking some courses to, bump up my knowledge in advanced science, etc., before taking the MCATs. And she found that there was an open house at Florida Institute for Traditional Chinese Medicine. She asked if I would like to go and that she would go with me, and I went and I was sold. It was going to give me the ability to practice medicine in a holistic way. So right up my alley, and it was exciting. So then I started on that journey and did the 3-year program there, which is equivalent to the 4-year Chinese medical school in China, and have been practicing since December of 1999.
My goodness, congratulations.
Thanks.
On 22 years.
Yeah.
I love hearing from your patients because you are able to treat, or rather, see so many different types of patients for so many different types of issues.
Yes.
Can you tell us just a little bit about the different types of patients you're able to treat and what type of situations that a lot of the viewers may not realize is an option?
Yeah, well, a lot of people see acupuncture and traditional Chinese medicine for pain type symptoms, whether it's back pain, knee pain, shoulder pain, and it does. It works great for musculoskeletal issues, but internal medicine is also practiced through traditional Chinese medicine. I enjoy assisting with fertility. Just 3 weeks ago, a month ago, I helped with some labor assistance, actually an induction.
Oh, wow.
And the OBs do refer for patients to be able to have a baby or an induction without having to go through the use of Pitocin and those types of things, a little more natural way. So that's always exciting.
Wow, that's amazing.
And everything really from autoimmune to common cold, whatever you would see your physician for.
I love that. So really a lot of primary care issues you can address in your practice.
Correct.
And I know a lot of my friends and clients are always looking for alternative type cares. We're not necessarily the ones that want to go to Western medicine first.
Right.
If we can find a non-pharmaceutical solution.
Right.
So tell me a little bit about, and I want to hear more about those services, but tell me a little bit about the main differences between Eastern and Western medicine.
Well, when we as acupuncture physicians, or really any practitioners of natural medicine, whether it's functional medicine doctors who are Western, some even Western MDs, chiropractors, etc. We look at things in a holistic manner. We're not necessarily disease-based, so to speak. We solve the puzzle. We want to figure out what is at the root of the imbalance, and we want to treat that. We do treat symptoms so that people feel better, but we also don't want to just put a Band-Aid on. We want to treat so that people have long-lasting optimal health. So Western medicine is a little different. Great for emergency medicine. You're not going to come to my office to get a bone set or if you have a heart attack or
a gallbladder.
Right, although I do get some phone calls from people.
Oh yeah, they'd like to see you first.
Please go to the ER. But so, you know, it's a little different in that respect. But I work with a lot of MDs and DOs, and I even have patients who are medical doctors. So it's just nice to think of kind of that marriage of East and West, and I like to call it complementary medicine rather than alternative, because neither is the be-all or end-all. You want to combine, and again, it's about optimal health and well-being for the patient.
Yeah, you know, that's really responsible of you to point that out, because it's not a one-stop shop or anything. But the integrative medicine has really gotten very, very popular. The East and West. I'm really happy that so many more MDs are open to these partnerships, and they're hungry too for more information and making sure their patients have the best care. Right. So what other types of doctors are you working with on treatment plans and receiving clients or patients?
Well, I have a great referral base, whether it's a lot of mental health practitioners who refer. We do get referrals from gynecologists, some from orthopedics. I had a referral from an ENT, a patient who had a pretty bad case of tinnitus, and I was really surprised that the doctor told her that her best bet would be to see an acupuncturist at this point, because tinnitus is very tough to treat, even in traditional Chinese medicine with acupuncture and herbs. It's tough, but we do get results.
I bet you've seen a lot of people suffering with the stresses of COVID over this past year or plus now where we are. And what are the type of treatments that you're able to offer people suffering from anxiety? I know that's a big one, depression, etc.
Well, we've always been able to treat those symptoms. Acupuncture has a great history of assisting people in the mental health realm. It does reset the brain chemicals basically, and is very relaxing because of that. There are endorphins that are released during an acupuncture treatment. What I'm finding now with a lot of patients, and also hearing just anecdotally, that people have a lot of brain fog. And it is because of, and that may not only be people that have suffered with COVID, but just the stress of this last year has been pretty intense for a lot of people. And when you're under stress constantly, it does something to those brain chemicals, and acupuncture does assist with resetting. It's a great reset.
And just the high stress lifestyle that a lot of us lead anyway, especially re-emerging into our social lives in the world. So tell me a little bit about how, with the stress management, and what other types of psychological issues have you been able to help your patients with?
Some ADHD issues and adult attention deficit, certainly anxiety and depression. Post-traumatic stress has been a big one too. I've treated quite a few veterans that have PTSD. So.
Awesome. Well, thank you for that. Marcie's really active in our community. She's really somebody that loves to give back to our community. And someone was telling me about how you have been, over the years, treating some cancer patients that are suffering, through their treatments and through, their battles with cancer. and that you've been able to help them out, even pro bono in many cases.
Right.
And who are you able to help out specifically as far as that patient base?
What I see in my practice is that when people are navigating through cancer treatment, there is a lot of anxiety from diagnosis to treatment, and then post surgery, post chemo, post care, always waiting for that next scan or that, So the acupuncture is a great assistant with those things, as we just discussed earlier, with the mental health aspect of it. Works really well for neuropathies.
Wow.
That, with many of the treatments, many of the chemo-induced neuropathies, and for women that have had gynecological cancers or breast cancers and then have to have the hormone treatment or lack of hormones post treatment. If it's a hormone receptor positive cancer, the acupuncture can help with mitigating some of the discomfort with hot flashes and night sweats and those types of things as well.
That is wonderful. That takes us into how you're helping with hormone therapies and hormone imbalances. Right.
And I don't do the replacement in terms of writing scripts for natural hormones. But again, with the acupuncture and with some of the traditional Chinese medicinal formulas, we're able to get a good handle on that in some cases. So
that is amazing. I love that. And you work on all ages, is that right?
Yeah.
Clients?
I tend to refer out the pediatrics because there's an excellent acupuncture physician in the Safety Harbor area who specializes in kids. I mean, she's the go-to for me. So unless it's a like an older child, or I do work with a lot of adolescents, but the little ones she's phenomenal with.
That's
so
great.
I do
You
send
always
them to her.
make sure your patients are matched up with the right practitioner.
Exactly. And sometimes, even with other things that people come in with, if there's someone out there that I know is, like that's their thing, they get referred to that person. So.
Fabulous. I love that. And Dr. Salazar's office is at 123...
132.
Oh, 132. And that's 10th Street in Safety Harbor.
Right. Yes.
Perfect. And tell us, what's the best way for people to reach out and connect with you?
You can do that by phone. The office phone is 727-216-3246, or I do have a Facebook page, Marcies Falco, acupuncture physician, or my website, marciefalco.com, and you can get that started on there. I do a complimentary consultation, either by phone or in person, to see if we're a good match and if I can assist. And if not, again, I do have a great list of referrals that I can send, where I can send people.
That is fabulous. I love that. So reach out to Dr. Salazar, and I do have her link on this feed. Also, guys, feel free to post any questions on this feed that you have for Doctor, and we'll go back and review those and make sure we get back and try to answer those questions for you. So I'm also so honored and so proud to have you a part of this event coming up, our Inspire the Fire Health, Wealth, and Wellness Expo on April 21st. This is getting big, so I'm just honored that you're going to be represented there, and that we're able to promote you there as well and celebrate all the amazing things you're doing for your patients.
Well, thank you so much, and thank you for inviting me to be part of it. Really appreciate it.
It's going to be amazing. We're really looking forward to it. So guys, reach out to Dr. Salazar, take advantage of that free consultation. A lot of doctors in her field don't offer that, and I think there's some value there, some good takeaway, even for just a few minutes of chatting with her. So this is Rochelle Insurance Girl with my guest today, Dr. Marcie Falco Salazar. Thank you again for coming.
Oh, it's my pleasure. Thank you for having me.
We look forward to featuring you at the expo. And again, Rochelle, just for the health of it, I am here for you as your health advocate. Thanks, guys.